All right, we'll go ahead and get started. So we have quite the selection of panelists today, which is really exciting. Thank you all for being here. Um, so today we're going to talk a little bit about gap years. If you need them, why you need them, what activities to do, how to, position them and talk about them on your application and things like that. But first, I'll just have everyone, all of the panelists, kind of go around and introduce themselves. My name is Nicole. I am currently in a research year between years 3 and 4 of medical school. And I will return to my fourth year of medical school in June. So I'm excited to be coming back soon. Yeah, let's see. Maybe Crystal, if you want to go next.
Hi, everyone. I'm Crystal. I'm a first year medical student at UCLA. Um, Nicole, do you want us to do our backgrounds now or later?
Yeah, if you just want to do a little background now, that would be great.
Okay. So I studied economics when I was in undergrad, and I also took the pre-med curriculum. And part of taking the gap years, my decision there was I didn't know if I only wanted to do medicine. So the advice I got was to try out other careers before committing to medicine because there's a long road and it's better to do it when you know for sure that that's what you want to do versus having those doubts throughout, the medical school journey. So I ended up doing 2 years in consulting, and then I did 3 years as part of a nonprofit that worked on product development for low resource settings. And it was part of like Gates Ventures. So I was up in Seattle. Happy to talk about that more later.
Well, thank you so much for that introduction. What an interesting background. So excited to hear more. Maybe Evelyn, do you want to go next?
Hey, hello everyone. My name is Evelyn. I'm alongside Crystal. I'm a first year student here. However, I am with the MD PhD program. So if you have any questions about that process, feel free to shoot me a message. I studied molecular cell biology in undergrad, and I spent about a year as a medical assistant, and a bit as an EMT as well, and 2 years as a laboratory manager at UCI. So my background's gonna be a little more research heavy just because of the career pathway that I'm going on. But I have to tell more about it in just a moment.
Awesome. Thank you so much, Evelyn. Yeah, I bet a lot of people will value your research perspective as well. Mario, do you want to go next?
Cool. What's good, y'all? My name is Mario. I am a third year, about to go on my LOA. I'm part of the Prime LA program. I'm about to go into my master's in science and clinical research. I currently work in the Bernthal lab where we study periprosthetic joint infections and clinical therapeutics, using a murine model and looking at like GLP-1s and also like spine pathologies as well. Didn't come into medical school interested in ortho. I actually took multiple gap years. I worked in a bunch of different intersections of medicine and like higher education, nonprofit work where I was a program coordinator for a science program in Oakland. Prior to matriculating into medical school, I worked as essentially a pre-health advisor at UC Berkeley for a program called the Biology Scholars Program, which helps first gen students who are interested in sort of the science fields and research, thrive in a environment like Berkeley. I worked as a medical scribe. I've worked as what else have I done? I worked for my sheriff's department for the Contra Costa County Sheriff's Department. I'm from the Bay Area. In the coroner's division, where I would assist forensic pathologists performing autopsies. I've worked in the research field. I've worked in public health. I worked in teaching. So yeah, a lot of different career pathways prior to coming into medical school. And I forgot which one of you said, I think maybe it was Crystal who said to try out fairly bunch of different pathways before going into medicine. But essentially medicine's a second career pathway for me. So yeah, it's a little bit about me.
Yeah, fantastic. That's something that I love about UCLA too, is I feel like so many of my classmates, like so many of us took at least 2 gap years, I would say is kind of the average, but I know plenty of people who took like 5, 6, had other, entirely other careers before coming to medical school. I also took a couple gap years, I forgot to say. during my introduction. But I worked for a nonprofit as well, like Crystal for a little bit. I worked for Kumon, if anyone's heard of Kumon. It's kind of like an after-school learning center for a little bit. I worked at a Starbucks while studying for the MCAT, which, I would recommend. Trying to take a more relaxed job if you are going to be studying for the MCAT during your gap years. Yeah, that's a little bit about me. Arthur, if you want to go next.
Hi everyone, my name's Arthur. I'm an MS2. I'm currently on the clerkship year. I took two gap years, so I applied at the end of the first gap year, and the whole application cycle's an entire year. So essentially 2 years between finishing undergrad and starting med school. I did undergrad at UCLA. It was a biochem major. During my gap years, I did some research in radiology. I continued a lot of my volunteer experiences with Salvation Army, did a lot of hospice volunteering, started some new volunteering projects as well. And I also started teaching at something similar to what Nicole described, but C2 education, which is kind of teaching high schoolers, middle schoolers, sometimes elementary kid students as well.
Awesome. Thank you so much. Wow, so many great perspectives to hear from tonight. I think we'll start with a very, kind of simple question. And that question is why did you all decide to take gap years instead of going right into medical school? Let's see, maybe Mario, do you want to go first?
Yeah, sure. I could go first. It was money. Definitely money. I used essentially the first, I think, 1 to 2 years I had off to pay off all of my undergraduate student debt. So I knew that, I didn't like having that hanging around my head, whether I continued on the medical school pathway. But then also I wanted to explore other aspects before I wanted going into medicine. I actually had tried to apply, I think, like right after I graduated undergrad at Berkeley. And then unfortunately I was waitlisted and didn't get in. So then I spent the rest of that time trying to figure out what I wanted to do with my life and then ended up coming back to medicine later down the line anyway. So, it's interesting how those roads changed, but mostly it was financial and handling situations with my personal life, specifically with my family. So yeah, that's essentially what led me into these gap years, but then it ended up going back to medicine either way.
Yeah, for sure. And other panelists, feel free to, kind of jump in whenever you want. But I'll echo that financial reasons are definitely something to consider strongly, as well if you have, loans coming out of undergrad. So I think, that's definitely a big part of a lot of people's decision in taking gap years. All right. Let's see. Anybody else have some perspectives?
Here, I could bounce off Mario's experience. Um, for me, after graduating, I worked as a medical assistant for a little bit as I was applying that cycle right after graduation. And same with Mario, didn't get in, waitlisted at a couple of programs. And I think for me, it was a moment of realization that like, okay, I don't really feel like I am ready for medical school. There's things that I still want to see in the world. There's things I want to do in the world. And also it made me rethink what kind of pathway that I want to lead as a physician. Um, so during that time, it was kind of a reassessing like what do I have within my application and also figuring out what I wanted to do. So that first time I applied just for an MD program. Second time, I worked in a research lab, built up a little more experience, and then applied for MD, PhD programs. Um, so I think having those extra years allowed for more reflection, like what exactly would you like to do within the realm of medicine? And that really helped me.
I'll
Yeah.
build off of what,
Oh, go ahead.
sorry, Nicole.
Oh, no, no,
I was
you
just
go
going to build
first.
off of what Evelyn said. I also in undergrad had friends who were computer science majors and also pre-med. And I think those conversations for me in my like junior, senior year of college really stand out because we were in similar positions where we had other interests, beyond science, beyond pre-med classes, and being a physician. And I think we both explored other career paths before because we wanted to, like, to what Evelyn said, like, we wanted to see what our careers, like, beyond being a physician would be, or in addition to being a physician. Because there's so many ways to practice medicine. And even now, as like a first year med student, like, I don't even know all of them, but there's so many ways to be a doctor. And so I just wanted to understand what my options were, also what my interests were, early on, too.
Yeah, I totally want to echo what you guys were both saying is I think, in my pre-med years, it was a lot of studying. I was very focused on trying to, get the best grades possible and like really set myself up well for medical school, but I didn't have a lot of time to really think like, oh, is this really what I want to do? And obviously, if you are going into a career in medicine, you do really want to be very sure that this is the career you want, because becoming a doctor does take many, many years. So for me, I think it was a little bit of I had other interests, so I wanted to make sure I didn't want to pursue those over being a doctor. So I minored in entrepreneurship. So that was just like one way in college where I was trying to like branch out into the business side of things, see if I was like interested in the business world. Turns out I wasn't really that interested. I did like sort of like the nonprofit and like startup side of entrepreneurship. So that was interesting to see. But I think the reason why I took the couple of gap years was to just do like more research into medicine, honestly, like shadow more doctors and make sure it's what I wanted to do. So, any perspectives from Arthur, if you have anything, and it's okay if you don't.
Yeah, I mean, I echo what a lot of what was already said. I think a large part of the reasons why I took gap years is, to explore further, to really ensure that this is what you want to do for the rest of your life. Because, like everyone else said, this is a very, very large commitment, and you don't want to go into this with any doubts. So I think that those gap years helped solidify and kind of like eliminate those doubts, or just convince yourself that this is exactly what you want to do. And also, I think that gap years are a great opportunity to improve your application in whatever areas you think need improvement. Because getting into medical school is very difficult, and I know that's like the elephant in the room, but it is genuinely very hard. So I think that the effort that goes into improving your application is definitely something that is very important. You don't want to constantly like, I mean, there's nothing wrong with reapplying, but it's a very difficult process. It's an expensive process as well. So if you know that your application has some weaknesses, then I think it's worthwhile to try to address those to the best of your ability.
Yeah, definitely. I think too, part of the reason why I took the gap years was also out of necessity because I hadn't taken my MCAT yet. Um, if you are considering going straight from undergrad into medical school, I believe the timeline is you have to take your MCAT at the end of junior year, so that you can apply during your senior year of college. So I really needed to at least take one gap year to, study for the MCAT and take that. So that's something else to take into consideration, whether you think you can study for the MCAT, alongside your other undergrad classes, or if you think you really need dedicated time to study. Yeah. All right. So we'll move on to the next question. And that is, how did you decide on which activities to pursue during your gap year? And, kind of going off of that, how do you think those activities, helped your application or just kind of helped you as a person? And anyone can go first.
I think what you do during your gap year, it can very much of it is completely up to you. But one thing I'd encourage you is to still make sure to keep your foot in the door with something medically related, some kind of clinical experience or medical adjacent, just to show, prove to yourself as well as to admissions committees that, you still very much are invested in this. And it wasn't just, oh, I got X number of clinical experience hours and now I'm done. And then for 3 years out of my gap year, you're never going to step foot in a hospital or some kind of clinical environment. I think that continued exposure up until actually, like starting medical school is a really good like sign to you and the admissions committee that you are genuinely committed in this. So again, like everything else, you can totally do what you want to do. You can do research, you can do volunteering, you can do a lot of employment experiences. But I do encourage everyone to have a clinical experience that longitudinally follows you up until matriculation.
I would also just to bounce off Arthur's point, do things that you wanna do, tie up any loose ends that you want to tie up because once medical school starts, it doesn't stop. With all honesty, like you're essentially locked in, and then you see your loan amount, and you're like, I am now financially locked in. Jokes aside, right? I pursued hobbies that I liked. I ended up taking like a Wing Chun class, a martial arts class in Oakland, where I ended up learning about Filipino martial arts, and I still teach that up to this particular day. I actually go teach in North Hollywood on the weekends, so I have some residents and like fellows and attendings that are from UCLA that come to my classes, which is nice. So, but it is good to always have that sort of reminder if you really want to go back to medicine during your gap years, like something that kind of pulls you back in, but to also explore other areas and talk about your particular journey. So, for example, for instance, when I was taking this Wing Chun class, this martial arts class, I ended up meeting somebody who was like some sort of like senior officer in LinkedIn, and I told him I was like, "Hey, I'm still particularly interested in medicine," and he was like, "You know what? I could help you out here. Send me your CV and your like LinkedIn," and he blasted it out to a bunch of these different physicians in the area, and I got a call back from one of them, and it ended up allowing me to shadow basically 1 week for in the San Francisco Zuckerberg, San Francisco, or yeah, pulmonary critical care department there. And one of the individuals I ended up shadowing happened just to be the chief of pulmonary and critical care. And so we got to talking. I told her, what I was interested in about building, early pathway programming for first gen students. And lo and behold, when I was in Berkeley, I was also part of the program that I worked for, and I was able to have these two directors meet with each other. And what came out of it was actually a program called BICEP that's still going on, and it allows students at Berkeley from that particular program to have the same, shadowing experience I had. And then I think they're also funded. So I think out of um, there's probably about 50 students now that have gone through that particular program, and some of them now are residents. Or I think we may have had our first attending. But what I'm trying to say is that if you are going through your journey, let individuals know what you're interested in, and you'll be surprised who will be out there to help you out. Like, don't just keep it to yourself. I know it can be a little bit hard to put yourself out there, but that's one of the things I would highly suggest you do during your gap years because you'd be very surprised. Like, who knows who and where, one of your aspirations may end up.
Hmm. Oh, sorry, Chris, go ahead.
I was just gonna, Arthur and Mario both made great points. I think just from personal narrative too, because my gap years were kind of not fully medicine related. Um, when I was working in consulting, I was in the industries of technology, media, and telecom, so there was no medicine in that. But to Arthur's point, I was working in Boston at that time, so I went to Mass Gen and volunteered on Saturdays in the emergency department. And then to Mario's point of, just reaching out and seeing who you could get connected to, like from a personal anecdote, like I would see physicians come to the emergency department for consults and I'd try to look at their names on their white coats. And then I'd cold email them to see if any of them would let me shadow. And so that's how I like got some shadowing experiences. in different departments of the hospital as well. So anecdotally, that's kind of how I stayed connected in my gap years. And then another piece of advice I got was just to, again, choose opportunities where you feel like you would learn the most because you've done 4 years of undergrad or, whatever your journey was academically. But those like years right after you graduate are like critical years where you can also have the opportunity to apply what you learned in undergrad, but also just to like learn a lot because your employers don't expect that much from you because it's your first job. And so if you can find places or find things you're interested in learning about, like I think people are interested in teaching too.
Yeah, I want to echo everyone's amazing points. I think my pathway also followed similar paths. Um, while working as a laboratory manager, I was doing some very basic science, but I still kept myself connected to the clinical realm. I worked as an EMT part-time, as a side gig. Um, that was a lot. You don't need to have a side gig in medicine, but continuing that shadowing, continuing working with patients, I think is incredibly important. For me, I also wanted to take some time to kind of step into like LGBTQ advocacy. So it was at that time while working, that I was able to really step into that role and see, how things are like. And I'm happy to say that's something that I continue to this day, even in medical school.
Yeah, that's awesome. Thank you all for those great insights. Yeah, I also just want to really emphasize what everyone was saying. Um, Definitely try to stay connected in medicine a little bit. It doesn't have to be the sole focus of your gap years. In fact, you can, and lots of people do, have other jobs before they start medical school. I'll also say that it's really important to keep your interests, and that's actually what makes you very interesting on your applications. So, like, I've been a dancer all my life since I was like 2 years old, and I love it. It's fun. Do like hip hop, jazz, contemporary ballet, you name it. It's a lot of fun. And I will say almost every single interviewer that interviewed me wanted to talk about that. Like they want to know you're a human and you also have hobbies outside of studying. So make sure to, don't forget about yourself and also do some fun things during your gap year too. Um, I think for our next question, I will ask the panelists. How did you best, position your gap year on your application, and how did that really fit into your application? Do you think it was, something that really added a lot to your application, or was it something small for you? Yeah, feel free to interject whenever.
I think a big piece of the puzzle is what matters most on your application is actually what you've already done at the time of submitting it. So if all of your gap year plans are kind of projected and you haven't actually begun doing them, you're kind of just writing that, I plan to start this in a month or so, then it's not really going to hold much weight, especially during the primary application review process. Um, on the converse, if you've actually done a lot of these things and you're applying towards the end of your gap year or whatever your timeline is, then obviously all those experiences just add to your resume. So yeah, a lot of it depends on, what you've actually done. And if you are taking a gap year, another thing I do really want to emphasize is a gap year in and of itself is not, just because the vast majority of med students who matriculate these days take a gap year, that does not in and of itself mean a gap year helps you. A gap year gives you more time to do a lot of things that, betters your understanding of medicine and gives a lot of admissions committees more confidence that you know what you're getting yourself into. So yeah, with that said, it's giving you more time to accomplish more, but you still have to do those things. You can't really rely on, I plan to do this to help you. Sometimes those things can help you during like an update letter or talking about it during an interview, and that stuff does matter. But the most important, the most important pieces of your application are what you're actually going to have on paper on your AMCAS as having been done.
I also like to chime in that I think what really helped me the most during the interview process was really having the experiences from my role as a role in the clinic. Um, it was really those stories that I was able to tell to my interviewers and talk about at length, and also demonstrate that I know what exactly it is that I'm stepping into, what kind of role I want to see myself in as a physician. And as much as what is it, being a medical assistant while I was applying that first time did help, I think it really took a while for me to really solidify those stories into kind of being able to elaborate upon them in an interview setting. So I think I would have really benefited that first time if I had planned to take 2 gap years rather than just one, to really get to know what the field of medicine is like before sending out the application.
And then my comment is more around letters of recommendation. So because I was pre-med in undergrad, I like had some letters of recommendation from my pre-med classes. But because I took quite a few, I felt like who I was when I was 18 was very different than who I was when I was applying. And so I ended up switching out a lot of my letters for more of my recent experiences. Because to Arthur's point, even if they weren't, the most medically relevant, maybe they had some like clinical like there's some relation to clinical work or otherwise. And I just felt like they could speak more to the impact that I had in the work that I did, in a way that was like more deep than me taking a class and connecting with professors in office hours, and outside of class. So I like still have those letters of rec. Obviously, I didn't use them, but towards the end, I was also thinking about, I think the AAMC posts like these 12 core competencies for like medical students. And I like looked at all of my, all the core competencies, and I tried to compare what I think each letter would speak to and kind of make me a well-rounded candidate in that way. So practically, when I was trying to figure out how to, strategize my application. That's one tactical thing I did.
Yeah, just to add on to Crystal's point about letters of recommendation. So I took multiple gap years, and it really just depends. You want to get a letter of recommendation writer who can speak strongly about your particular qualities. So if you had a relationship and you continue to maintain that relationship with that particular professor during your gap growth years, whatever they call them now these days, what the time before you apply to medical school, right? Um, that would be your best bet. So what I mean by that is like you check in with them every couple of months, right? So then you could send them an updated sort of letter. Or if you are more on sort of like what I did was, I ended up taking classes at UC Berkeley Extension just to not only bolster up my academic GPA, but to show, since I've been out of school for a while, right, that I'm still academically viable, I guess would be the nice term to put it, that I could still do the coursework that would be required of in medical school. So that's where I got my science letters of recommendation. But I still had letters of rec come from undergrad, but maybe just not in the sciences, right? So it really just depends on who can speak to your qualities the best, right? And I forgot what the original question was, with all honesty. I just saw the letters of recommendation question. But you could also have them stored in your folio so that those individuals can end up going back and updating your letters of recommendation as you update your CV when you're applying. So that way it's not like they have to start completely from scratch. They have something, and also you can continually update those individuals you want to request letters of recommendation for, depending on how long those your gap years are.
Yeah, I also just wanted to add something about, I forget who said something, but about interviewing and talking about your gap years. So I think it's really important to now during undergrad kind of start to think about what your story you're going to tell to the interviewers is. And I know that sounds kind of weird, but they are going to want to know kind of in a succinct way Like for me, I was like, okay, I'm a dancer. Like I'm really interested in this field of medicine. And I did, these activities um, because, it all fits into my story of why I'm interested in dermatology, for instance. So I think it's something kind of important to think about. And then other advice that I got from I forget who it was, but when I was interviewing, told me, you're only as good as you can describe to someone else. So really, like, they don't know who you are. They've read, maybe glanced over your application very briefly, maybe read a few paragraphs about you, but they really don't know who you are until you can very specifically iterate to them who you are. So really do practice and really do think about the story you want to tell admissions committees because honestly, I think once you get to the interview part, like if they've offered you an interview, you're good enough to be going to that medical school. You are on the same playing field as everyone else. They just want to see that you're human, that you can talk about your experiences, and they really just, want to hear your story. I guess we can kind of, go off of that same topic. Do you guys have any thoughts on how you brought up your gap year during interviews, and if that was integrated into your story per se?
I could go first on that one. It was very much integrated. You'll find when the more you take off and the more that you sort of go away from medicine, you'll see that everything if sort of interconnected in regards to the activities that you decide to do. It's just, sitting down and reflecting about, why that activity was important to you. In regards to sort of how that came up in my interviews, most of my medical school interviews were more interested in what I did after undergrad, right? It wasn't even like we already saw your undergrad stuff. We don't really matter. Like, oh, I wanted to talk about, oh, hey, you teach over here, or you teach martial arts here. You do these things. So you'll find that you'll have a very distinctive story once you start weaving these pieces together. And the point of, whether you take a gap year for academic enrichment or you take it to explore and reflect about why you want to continue to do medicine, it's up to Nicole, like to Nicole's point, is how you are able to coherently describe it to somebody in a highly stressful situation, like a 30-minute interview that'll decide your fate for the next, what, 3 to 4 or 5 years, right? And so really think about that, about the activities you've done so far. Like, even after if you don't decide to take a gap year, really reflect on the activities you've done in undergrad and think about why you did them, right? Were you doing them as something to just check a box as like, I see this is important for a competitive applicant, or were you truly doing them for, a reason that you feel resonates with other aspects of your identity, right? So I would highly suggest you don't go into your gap years being like, I need to check a box for research, right? Think about goals that you really want to achieve on your bigger picture of where you want to see yourself in this life and where you see like a medical career fitting in, right? Not just I want to be a doctor, but especially the more time you spend outside of, undergrad, right? The more years you take off, essentially they want that idea to be fairly concrete, right? It's not just like I want to be a doctor, but like where's your place of practice? You want to practice in an urban setting, a rural setting? What patient demographics do you want to see? Why specifically? Like those were the questions I was asked because I took multiple gap years and I was able to, through my experience, answer those questions comfortably because I knew based off the experiences that I had during my time off, where exactly I wanted to, where when I'm in this like why I'm here, right? I'm not over here playing undergrad 2.0 in medical school. I know where I want to go, who I need to talk to, and where I envision myself being. And that's what I think that taking a little bit more time off after undergrad provides you that semblance and that perspective.
I'll make one other quick point too, which is, I thought that my all my interviews were going to focus so much on my gap years because, in your application, if it hasn't changed, you can write like three of your activities and call them your most meaningful experiences. And, I thought they'd ask me all these questions about my gap years. And then in one of my interviews, I had someone ask me about this research project that I did as a junior, that I did for only a few months, but I decided to include in there anyway. And I was a little thrown off guard there because I didn't expect it as much as all the other questions that they asked. So I think the overall point is just really know your application well, like whatever you put in there, even if it's a very minor detail, like they can choose to ask you about that. And to Mario's point, like you don't want that one moment of you not really knowing your application to define your 30-minute impression of who you are as a candidate. So no matter what you do, even if it's undergrad, even if it is your gap years, like just really know what you did.
Yeah, I could not agree more. That is extremely, extremely important. You need to know your application. Like, I mean, even the back of your hand is an understatement. You need to know every inch of your application because you could be asked about anything. And if they ask you something and you don't really even remember or you don't know what to say, it looks like either you possibly just like didn't even take that activity seriously, so it's not a good look. The name of the game of interviews is preparation and giving off that impression that you're very, very serious about this. This matters a lot to you because it's not just like what exactly you answer with, but it's also showing that you put into preparation to give an answer that's succinct and makes sense and is very relevant to what they're asking. So whether that's gap years or anything else, you definitely want to treat interviews like a very, very important thing that you should be preparing for. Like you're almost always going to be asked, why do you want to be a doctor? Why do you want to go to medical school? Why medicine? And your answer to that should be, it should make a lot of sense. And most importantly, it has to be supported by things you've done. Otherwise, there's no real evidence to what you're saying. And that holds true for a lot of the application and interview answers. Um, Everything you answer with should be supported by something you've actually done to prove what you're saying. Otherwise, like anyone can say X, Y, and Z, but the people who are taken most seriously and who are believed are people who've done things that actually demonstrate X, Y, and Z. So, genuinely think about like what Mario was saying, like why did you do X, Y, and Z activity? Like really sit down and think about why you did those things, what they demonstrate about where your interests were, what they taught you. And yeah, just try to build an application that supports the narrative that you want to give. Because you can have all these aspirations, but if you have to also put in the work to demonstrate that you are the person you say you are on paper.
Yeah, I guess on that same note, I think it's what is it? Being throughout my interview cycle, being able to describe what was on my application was quite straightforward, easy, because I did things that I was genuinely really interested in. Um, so I think I remember I got a random question about a essay contest that I did like in undergrad, and I was able to talk about it in depth because honestly, that was my passion, that was my love. Um, so as you're looking into things that you may want to do, think long and hard about what exactly it is that you love to do, and then see if you can find some career that's maybe medicine adjacent. If not, even it doesn't need to be medicine adjacent, and pursue that, because ultimately that's what I think will add the most to your interview experience. Um, and in terms of like how I frame my gap years on my application, there's like a little blurb on a lot of secondary applications where it's like, oh yeah, what did you do in the past like couple years between now and undergrad and now, and that's where I put it. I don't think I really talked too much about my experience academics during my interview process. So at least for me, my application was very, very centered around what I did during those gap years.
Yeah, thank you all. I feel like we're getting such great advice. So I think the next kind of thing we'll focus on is sort of, did you feel like you were behind because you took gap years? I think I'll kind of start by answering this question. And initially, I did. I felt behind because I come from a strict like household and family, and I was like very scared to tell my parents I was not ready to apply. Scared to tell my friends like, I hadn't taken the MCAT yet. I felt very behind from all of my peers. But now sort of on the other side, I really do see a new perspective, honestly. And I feel very grateful to have taken my gap years. So, during my gap years too, I really delved into the different fields of medicine. Like I looked up every single specialty. I was like deep into researching every single specialty, what their life looked like. I really just wanted to know like what my life would look like if I went into medicine in these different like fields of medicine, and if that is something I truly wanted. So, going into medical school, I actually knew I really wanted to go into dermatology. And that's because I did a lot of research. I really found like a dermatologist who I shadowed before med school and like loved the procedural aspect of it. And now I think I want to, go into skin cancer surgery, which is like Mohs surgery, within dermatology, because I think it's very cool. And also, I think, something to consider is um, honestly, like lifestyle. People don't always tell you to consider it, but I do think it's very important to think about, like, if you are considering surgery, for instance, is that the lifestyle you want, and do you want to keep up that lifestyle for, a very long time? Some people really do enjoy just different fields for different reasons. But I think that was, kind of something I thought a lot about during my gap years and something I'm grateful for now. Um, but yeah, I'll let you guys answer now that I've talked everyone's ear off. But the original question was, did, taking gap years make you feel behind? And how did you kind of overcome that, if so?
And going to your point about if you're interested in surgery, I stepped out of a 12-hour scoliosis surgery for ortho. So if you're not into standing up for 12 hours in one procedure, um, jokes aside, I didn't feel behind with all honesty. As soon as I committed to actually deciding that I wanted to go to medical school or try to reapply to medical school again, I ended up choosing being prioritizing activities that I knew that I would benefit me as soon as I started. So I started taking classes like at UC Berkeley Extension on like immunology, like stem cell biology, whatever, those like considered upper division science classes. And then I started to pick up more cases where I work for in the sheriff's department and coroner's office. So my job there was actually to do like go on body pickups with the deputies and do organ evisceration, so and take samples. So essentially I was doing what pathology residents do if they're interested in forensic path prior to even medical school. And so, uh, and and then on top of that, I used the time that I had while I was before applying to medical school to sort of network with individuals I knew in different medical institutions to, sequester advice on how to best, succeed in medical school. So once you make that particular decision, you can spend that time to prepare yourself for what's to come once medical school starts. So yeah, I definitely didn't feel behind with all honesty. The only thing that did throw me off is all the crazy amount of standardized testing and then also having to, live off loans after you've gotten an actual salary or money was the wildest transition. But yeah, that's my 2 cents on the situation.
I would say that I did feel behind at times, especially because most of my friends were taking maybe 1 or 2 gap years, um, you know, or going straight through. And so I was like kind of on that tail end where my friends were like, "Are you ever going to apply? Is this something you're even passionate about?" And to Nicole's point, like there were times when I was like, "This is the year I'm going to apply." And then I didn't feel ready and I enjoyed what I was doing at work. So, or maybe that was a shield that I didn't feel ready. And so I definitely felt that. I think now on the other end, when I'm in my first year, I'm realizing that a lot of my friends are more senior to me in medicine. So I have friends who are residents now, and I have friends who, are just 1 or 2 years older than me in medical school and other places. But it's been really helpful to like have their perspectives and their advice, thinking about residency, thinking about attending, being an attending and all of that as well. So, yeah.
Yeah, I think for me, I felt behind, but mostly because of my experience being reapplicated. It's like, oh yeah, I kind of had that expectation. It's like, okay, this is how my path's gonna go. And then when it didn't go that way, it's like, okay, I'm always gonna compare to that initial process. So I think for me, it's more comparison to myself. But in terms of comparison to my peers, yeah, same with Crystal. I'm one of the younger folks in the class. And honestly, getting to hear what other people have been up to up until they entered here um, has been so much fun. And yeah, I don't feel like I'm behind at this current moment.
I think that, like, comparison is the thief of joy. And if you're constantly comparing yourself to where other people are, there's a 100% certainty that you'll find someone who is younger than you, who accomplished something that you want earlier than you. So yeah, if like feeling behind is natural, like in this process and in life in general, I think. So I think just, trusting that you're doing the best that you can do at this moment, and you're constantly pushing yourself to, like just be better than the version of yourself yesterday, and then just live with that. Don't compare yourself to other people, because those people don't have your same story. They don't have your same background. They didn't go through the same obstacles that you did. And only you have gone through the exact sequence of life events and obstacles that brought you to this point. So just keep that perspective in check. That'll help combat some of those like very natural, very human emotions of feeling behind, which I think is one of the biggest, like at least emotional fears people have around gap years. And it's a very human thing to feel. So yeah, just keep that perspective, and that's at least what helped me during those moments.
Yeah, and I also just want to echo what Evelyn said earlier about no longer feeling behind. I really don't feel behind anymore being in medical school and being just around such like diverse class of people. Like everyone has been through like so many different stages in life. Like I have a classmate who has 3 kids and she had like a whole job as a real estate like manager before medical school. So there's a lot of people from a lot of different perspectives that will probably be your classmates, and you'll see everyone just kind of has their own path in life. So I really wouldn't, be, convinced not to do a gap year because, you're afraid of being behind. Definitely don't let that, convince you against it, basically. All right. And then we will briefly talk about the MCAT and studying during your gap years. So I just want to ask each of the panelists if you took the MCAT, before your gap years, during your gap years, and how you really worked that into your schedule.
I'll go first. Studying for the MCAT during my gap years sucked because I was working a full-time job, taking classes at UC Berkeley Extension, and then working a night job as well. It honestly is, you have to prioritize really what's important to you. Time management is vital during those times, especially if you have, other, say personal circumstances or external circumstances that you have to deal with. It's honestly about finding and creating time for this particular test. It's going to be the same when you take, whatever, step one, step two, whatever board exams. You're going to be busy regardless of what you do. It's honestly about finding the time to and making the time to actually study for these particular exams, because they do unfortunately, help you progress in your medical career. And so for me personally, what I did was I woke up early, probably around like 4 or 5 in the morning, study before work because I knew that there was no way that I could study after work or even after classes. And then I would take advantage of liminal moments where, where I'd have breaks or free time, like standing in line, going to the grocery store, and use that time to study. So the one thing that I kept in mind is something is always better than nothing. And it's consistency that is key, especially when you feel that your time is limited. So you have to just try to do something each day. It may not be you get an 8 hour study block. It may just be you have 30 minutes. But that 30 minutes, it compounds and it's summative, right? It'll all, result in the result that you want. I don't know if that makes sense. But what I'm trying to say is do what you can each day, right? That's the most important aspect of it.
Absolutely, 100% agree with that. Consistency is like the number one, in my opinion, predictor of a strong MCAT score. I took my MCAT over the summer. I personally think it's one of, if not the best times to take it, just because you can have like a condensed, pretty intense study period. I do think that like the MCAT as an exam is kind of designed for that form of study. Because if you study for like a very, very long period, I do think there's a point where you're no longer improving and you're potentially forgetting a lot of things that you previously learned. But also, yeah, like find the time and I would study at the gym. I'd have like Anki on my phone, while I was studying at the gym, studying lines wherever you are. Just trying to like maximize any opportunity you have, and it really does add up. Um, and I'd also, yeah, I do think that do a lot of practice questions. The more practice questions you do, the better. I'm a huge advocate of Anki, especially for the MCAT as well. I think it's a really good for remembering a lot of those, like a lot of those little facts, throughout all the science subjects. But yeah, like Mario said, consistency over everything. Like, don't let, you had a really hard day, you had a long shift at work, you're just exhausted. Don't let that be an excuse to do absolutely nothing. Like, try to get in like 5 year-old questions. Like just don't let yourself make the excuse to do nothing for that day. And I think that'll really go a long way for your score.
I was lucky enough to finish taking the MCAT before graduation, so I think my experience is a little bit different. But I do want to echo Arthur and Mario's point, in regard like for that consistency and that kind of quote unquote grit as you're approaching applications. Writing the essays are no joke. The application process in itself honestly felt like to me a part-time job in within itself. Um, so finding a time to say make sure that you carve out some time to work on those applications after work on the weekends, because that is quite a bit in within itself.
I don't have much more to add. I think everyone's covered those bases, but I retook my MCAT because the first time I took it while working in consulting and it was early. I think I just started my job 2 weeks before I was scheduled to take it. And so those 2 weeks when I was learning a new job and not telling anyone that I was, studying for the MCAT and I had this big responsibility as well, that was probably not the smartest thing that I could have done, but um, so then I ended up retaking it while I was working and just I answered this in the chat, but I think just really managing your own expectations and knowing that in that period where you're going to be studying for the MCAT, like it might be a time where you're going to have to be more disciplined than you normally would be. But that phase can end as well. So, um,
Yeah, for me, I also took my MCAT during my gap years. I would say I also retook my MCAT, and the first time I took it, I was like I had a full-time job and so many responsibilities. It was very hard to just kind of focus on the MCAT for a little bit. So I almost took like a dedicated period, and if you're able to do that, I would suggest doing it. If you could even, live at your parents' house for like a couple of months, or anyone, who would be like supportive in your life to help you out, where you don't, have to work for a couple of months. I think it was very beneficial for me to have kind of that like dedicated study period, before I took my MCAT again. Yeah, and then I guess we only have a few more minutes left here, so I'm gonna kind of scroll through these questions you guys have put in the chat and see if there's any we can answer out loud for you. There is a question that says, when looking into clinical jobs, do I need to obtain a certificate? Um, I believe it really depends on the specific medical job. So, for instance, if you want to be a medical assistant, usually there is a little bit of a certification to become a medical assistant. I don't know if any of the panelists went through that. I looked into it initially, during my gap years, and I think it was like a 3 month sort of certificate program. And then once you have that certificate, you can apply to, different clinics, to work as an MA or a medical assistant. And that's kind of where you help like doctors out with whatever they need during clinic. You help kind of, set up for procedures, if, the clinic does procedures, things like that. But I think yeah, it just depends on the clinical job. Any other thoughts?
It really depends on the clinic that's trying to hire you for whatever MA position or whatever other clinical job. If you're able to supplement that or during that interview process to let them know that you have prior experience doing certain things, then it's up to that person's like clinic manager to decide. Most, if you're trying to work for like a Kaiser or like a big name hospital, they're going to require certification. But if you're looking for to working at an MA as an MA in private clinics, it's actually up to that clinic and their standards.
Let's see, we'll try to go through a few more of these, if we can. So let's see, maybe how about the one that says, do you think working part-time as a medical scribe is helpful for clinical experience? I actually had multiple friends, that worked as a clinical scribe during their gap years, um, and it was very, very informative for them. And a lot of them said that the time they spent in that clinic, came up a lot on interviews because, during that time they were able to really see how the clinic was run. Typing up notes as a scribe is also very helpful, and is a good practice, to just learn before you get into medical school anyways. So I'd say it's really good experience.
I could add to that. I was a medical scribe in for the ED. It was the only job I could find that could work with like a night shift, like an 11 p.m. to 7 a.m. or an 8 p.m. to 4 a.m. job. I will tell you on your clinical rotations when you're writing notes and when you have to use different types of electronic health records, very, very helpful to know how to use shortcuts and stuff if you already use, say, Orchid or Cerner or you know how to use Epic. I would say that's the best thing. And then if you're also interested in like, emergency medicine, night shifts are the best time to actually talk to the physicians because either it's really busy or it's really slow. And then they get to talk to you more on a personal level as a side.
Yeah, actually, I'll kind of echo that really quick too, is if you have the chance to shadow in an ER, I actually think that's one of the best ways to kind of get exposure to medicine at this point, as a pre-med. You get to see a lot of different things. And like Mario said, if you can shadow during the evening time, towards the later shifts, a lot of the times the physicians have, a bit more time to talk than during the day. So I think that's a great experience. All right, guys. Well, I think we will wrap it up. Thank you so much to the panelists for being here and sharing all of your experiences. And thank you to the attendees, of course. I hope everyone, got something out of this session. We usually have, a few sessions a month, every other Monday, evening. So feel free to join again. All right. Hope everyone has a good rest of your night. Thank you, panelists.
Take it easy, everybody. Nice to meet everyone.